If you just heard the words, "you have cancer," you feel fear, panic, complete loss of control, and you may think your world is falling apart. I know you're looking for a map right now. In this video, I give you 10 immediate steps to take. This plan will help you transform the feeling of panic into grounded, organized action. I'm Dr. Michal Chovanec, and as a professor of oncology, I see these stories of patients every day. I know that having a plan and organization of our feelings and actions can help you tremendously throughout your steps dealing with cancer. Pause and breathe. I know it's a lot to take right now, but taking that deep inhale and exhale will help you slow down your mind and keep you organized and grounded. Breathing exercises can help you tremendously with dealing with cancer, and I recommend you learn those along the way. Step number 2, bring a second set of ears. It's always very difficult to be organized in lots of medical information. Bringing somebody with you, it may be your friend or a spouse, will help you keep the information retained that you need. I can see that in my patient every day. You may be out of focus. There's a lot running through your mind right now, so you don't really hear every word the doctor is saying. It's really important to not be by yourself when you go to a doctor's office. Step number 3, create a binder. You're going to receive a lot of medical information, a lot of reports, and you will want to take notes. This will help you feel organized. This will help you remember your chemo schedule. This will help you keep the contact of your doctor at hand when you need it back at home. Step number 4, get a copy of your pathology report. This is going to be your single most important document you're going to have about your cancer. This is going to determine what type of treatment is possible and how we are going to approach your treatment. Always have it at hand and make a copy for yourself just in case. Step number 5, consider a second opinion. This is not something abnormal. This should be completely normal, and this should be supported by your doctor. I always support my patients in taking the second opinion because I know this will bring them a peace of mind in deciding what treatment type we need to do, what steps should we be doing. This will also bring you a lot of trust in your doctor. So let's continue to build that trust. Hearing second or even third opinion will make your life so much better. Step number 6, Google Smart. My instinct is to tell you not to Google at all. There's a lot of misinformation on internet, and it's going to be difficult to know what's right and what's not, what's true and what's false. But I know you're going to Google anyway, so I'm going to tell you Google Smart. Look for information that is relevant and reliable. Look for information that is published by authorities on website by official oncology association, just like American Cancer Society or American Society of Clinical Oncology. We also use guidelines, so you're free to look at that as well. And if you ever don't understand what's going on and what's written in there, just go to your doctor and consult with them. They'll be happy to explain everything that is needed to you. Step number 7, define your story. You don't have to tell the whole world at the moment. Just tell those people that are close to you and that matter. They're going to help you with those first initial steps. Take your time, and only when you feel ready, you can show the world you're battling with cancer. Step number 8, build your home team. This is going to be your team who fights for you in every single scenario. This should, of course, include your family and friends, your physician, but also your therapist. This could even be your taxi driver who takes you to the clinic. Just remember, always surround yourself with people who you trust that are going to be on your team, that they are going to help you in the process. Step number 9, create specific task requests. If somebody asks you, "How can I help?" do not throw them away. Do not say, I have everything right now. But ask them, can you take me to my next Thursday appointment? Can you bring me the dinner on Tuesday? Try to think about it and come up with the specific tasks that are suitable to you. This will help you greatly, but this will also help your close ones greatly. They're going to feel like they're helping. They're going to feel involved. And finally, step number 10, do something for yourself every day. I know it's a lot to take. I know you feel overwhelmed, but it's important to do one normal thing each and every day in order to feel normal, in order to be able to feel joy. Do something that is joyful to you. Go for a walk with a dog, play with your kids, play a piano, or go play sports. You are not invalidated by cancer. You should be able to feel normal and you should pursue the normalness in your life, which will help you maintain your identity. This is your map. If you feel overwhelmed, come back to this video and watch it step by step. It will help you throughout your next steps. If you found hope in my last video, this one gives you plan. Your next essential step is to learn about specific signs of cancer. I recommend you watch my next video. What are the first signs of prostate cancer? The doctor explains. If you found this video helpful, please subscribe. My goal is to make complex medical information simple and clear. I'm happy you're here and I'm here to help.